Hey guys, Carlson back to wrap up Chapter 6 of Skeletal System with Part 3 of our video lecture. We're going to pick up where we left off with Section 9 that talks about joints, or otherwise known as articulations. Now these articulations occur wherever two bones meet. The structure of that joint is going to determine the movement, and there's always a compromise between having strength and stability versus movement. Normally if you have a lot of movement, you lose some strength and stability. If you have a lot of strength and stability, then you lose movement. So there's a balance there with the different types of joints. And then we can classify our joints both by their structure or their function. And the structure part is based on anatomy. So we look at the type of connective tissue binding them, and there is a fibrous type and a cartilaginous type. These two types of joints do not permit movement or some slight movement. Synovial is a big one we're going to be focusing on the most because it does permit the most amount of movement. As far as function goes, we can also classify joints by their range of motion allowed. Synarthrosis means they're immovable. Amphiarthrosis means slightly movable, and diarthrosis is freely movable, which we also call a synovial joint, hence why we say it permits free movement. Now, taking a closer look, there's a table in your textbook, 6.2, that I want you to take a close look at. I want you to look through the different categories. I want you to look at the descriptions and some of the examples. I'm not going to talk about them all right now. But just as an example, a synarthrosis joint that's made up of a fibrous structure is a suture. And sutures are fibrous connections plus interlock surfaces. And a good example would be between the bones of your skull. Now, that makes sense because we don't want the bones of our skull to move. Now, if we go down here and look at synovial structure, it's, again, free movement, and you'll notice that when we talk about all the synovial joints, they're usually slightly complex. They're bounded by some kind of capsule and some kind of synovial fluid to help lubricate and pad that joint. A little bit more information about synovial. Under normal conditions, the bones do not come in contact due to that articular cartilage. Complex joints like the knee have shock-absorbing pads called menisci, which is just plural for meniscus. There are also small pockets of connective tissue with synovial fluid to, again, further reduce friction near tendons and ligaments, and those are known as bursae, plural for bursa. All right, 6.10 gets into skeletal movements enabled by our synovial joints. These are important because they're involved in our day-to-day activities. We have specific terms for movement that are used that have particular meaning when we refer to the anatomical position. So make sure when we're referencing these, you are thinking of the anatomical position. So one type of movement is gliding. This is when two opposing surfaces slide past each other. A bunch of angular movements are something we're more familiar with. Flexon versus extension, which means we decrease the angle versus increasing an angle. If we hyperextend, you actually move past the anatomical position, and this is usually prevented by ligaments, bony processes, and soft tissues. Could cause pain if you do hyperextend. Some movement with hyperextension is normal, actually, for the body, and we'll look at that in a second. Abduction is movement away from the body. Adduction is movement towards. And this is in reference to the longitudinal axis, and then we also have circumduction. So if you look at this picture here from the book, it's showing you flexion versus extension, and then if you hyperextend past the anatomical position, it's also showing flexion versus extension with the arm at the elbow and at the leg. Over here you have your abduction away from the body, adduction towards, again with wrist, leg, and arm. You can show it with opening up the fingers and bringing in the fingers, and then circumduction is just a circular movement with a portion of the body. A few more types of movement. We have rotations, which involve turning around the longitudinal axis of the body or the limb. If we're looking at the wrist itself, we're talking about pronation versus supination. So this is pronation, the palms would turn down or rotated back. And then supination, it would move the palms back forward in the anatomical position. Just a few more special movements. I'm going to let you look over those on your own. Some of them may sound familiar. We have inversions versus eversion. So inversion brings it medial. Eversion brings it lateral from the longitudinal axis of the body. Dorsiflexion basically digs your heel in and pushes toes up. Plantar pushes toes down. Opposition versus reposition is shown here, so we can kind of bring in and then release out. Oops, sorry about that. You have protraction versus retraction here, elevation and depression, and then also some lateral flexion. So again, you could take a closer look at the descriptions in your book as needed. And then also with the types of synovial joints, there's a page 178 in your textbook goes through these. Take a look at them. I just think it's nice to see the pictures on what the gliding joints actually look like in the body, and then they show good examples. Some of them are obvious, like I think ball and socket, the saddle joint. Condylar is probably a little new for you, and a few of these over here. So just take a look at those. I'm not going to talk about them each individually. I think they'll just help you remember what the joints do. Okay, 611 covers the intervertebral and appendicular articulations, which play a big role in support and mobility. Intervertebral has to do with the axial skeleton, and the four synovial of the appendicular skeleton are in reference to the shoulder and elbow of the upper limbs and the hip and knee of the lower limbs. So taking a closer look at the intervertebral articulations, we're focusing on the vertebrae and the sacrum that articulate in two ways: at gliding joints in between your superior and inferior articular processes, and then at the syphincele joints between the vertebral bodies, which is essentially your intervertebral disc. Over time, as we mature, this gelatinous layer of that disc can become less effective, and the elasticity of the fibrocartilage will also decrease. This is what causes possible herniated or slipped discs if sufficient stress is applied. And then also degenerating over time is water content of the disc, and this is actually what causes us to decrease in height as we get older. Articulations of the upper limb are going to involve your shoulder, elbow, and wrist. They're responsible for positioning the hand, and this results in precise and controlled movements. Our shoulder has the greatest mobility. Our elbow has great strength but limits mobility. It can only flex and extend. And then our wrist with palm and fingers makes fine adjustments. And notice here we have a ball and socket joint, which remember creates a lot of movement, and our shoulder will provide us with the greatest range of motion of any joint in the body. What forms this shoulder joint is the glenoid cavity along with the head of the humerus. So, and then the articulations of the lower limb include our hip, ankle, and foot. They have smaller ranges of motion because we are sacrificing that for more sturdiness, which is greater than that of the upper limbs because the lower limbs have to bear more weight. So taking a look at the hip here, you can see that the joint is formed with the acetabellum and the head of the femur. So again, we have another ball and socket joint allowing for a good amount of movement. Now, our knee has a range of motion similar to the elbow. However, because of the greater forces it's subjected to, it's less stable. It is a complex hinge joint and has three separate articulations, two between the femur and the tibia, or the larger leg bone, and then one between the femur and the patella. Lastly, section 12 just points out that the skeletal system provides support and energy and mineral storage for other parts of the body, as well as other parts of the body provide support for the bones. So we have to remember that the bones undergo continuous remodeling. That balance between bone formation and recycling involves exchange with other systems. For example, the bones provide attachment for muscles, while the digestive and urinary systems provide calcium and phosphate needed for growth. And there is a really neat system integrator that's going to be at the end of each system from now on. The one for this one is page 188, and I go ahead and take a look at it. There's not a lot there yet, but as we keep on getting further and further into other systems, everything will be added on, and you'll see how each system kind of works with the other. And that wraps us up, completes our overview of the system of the skeleton. And you can go back and look at this PDF file. I will put it onto our Unit 3 folder on Schoology, and go back as needed, and I'll see you next time.